Good morning, I'm Dr. Peacock. This morning I wanted to show you a patient who had multiple symptoms with the foot. Let me show you his foot before we did surgery on him. Got him in the Peacock press here. You can see he has a fairly significant lesion in the second metatarsal. If you look at the Peacock press, it's blanching in the second, third, and the fourth metatarsal. Just to give you an indication how his foot looked, he had a fairly significant bunion deformity with some abutting of the second toe and a pretty bad Taylor's bunion as well, so he had problems here. So what we did with him, we did, let me show you some x-ray here. This is his x-ray here. What we did with him, we did a bunion correction with an osteotomy. We did percutaneous metatarsal osteotomies the second, third, fourth, and the fifth to correct his bunions on both sides here. This is about 6 months later. You can see everything's kind of healed now with all our different bones here. There's another concept I want to talk to you about. When we did his bunion deformity, he had a hypermobile first ray or a high CERM-PERM level. So the way we did his bunion, we cut it in a procedure I call the modified Peacock, Isham, Reverdin, Bosch procedure. And what this procedure is, it follows a very simple pattern like the Reverdin Isham bunion does, where you take a wedge to correct for PASA. But we do this a little bit further back, not in the metaphyseal, more in the early diaphyseal bone here. The cut is angled about 45 degrees. The modification is that if you're looking at a lateral aspect of the cut, we do a little J hook. And what this does, this gives a little extension on the plantar lateral side. And that allows us to, when we move the bone over, to maintain length. And in this case, we were plantarflexing his first ray, and to maintain a pressure on the first ray. It also gives a little fulcrum, a little place to get greater stability of the metatarsal. Now, the way we fixate this, and the reason I put the name Bosch in there, is we fixate this very similar to the way Bosch describes his osteotomies. And so when we do this, we fixated the fifth just like Bosch, and then a little modification where we do on the first met. If you can see, there's a little lipping on the plantar aspect here that allows me to keep good length to the first metatarsal, and we can get a little gapping here so that we get a little stretching of our metatarsal without getting a lot of shortening. And if you can see now, this is about 6 months later. If you actually superimpose the first met onto the first met of our initial x-ray, you can actually see we actually got zero shortening of the first ray. Another thing is I want to show you is we talked about the Peacock press and how we're quantifying it. Here's his ultrasound today. His ultrasound that shows the second, third, and fourth mets. You can see they're pretty even. This is in the Peacock press. The one is 1.25. The third met is 1.75. The fourth met 1.25. So actually the third and the second met, fourth and the second met are exactly the same level. So we got a lot of cushion under the metatarsal heads now, and that's why he's not in pain. Here's our patient. Ted, we did a lot of work on your foot, didn't we? How's your foot now? You have any pain with your foot at all, or is it hurt at all?
No, sir.
No pain at all. And even before, where you had the pain under the ball of your foot, that's gone too.
Yes, sir.
All right. Well, good. So there's the patient. He's able to go back to normal activity, and did a lot of work on him, all in the office under just local anesthetic, utilizing concepts of both biomechanics and minimally invasive surgery.